Okay, so today we would look at the physiology of blood. In our last class, we talked about blood and we talked about plasma in general and listed what plasma is made of and the contents of plasma. We talked about the water content of plasma, the protein content, and then we talked about the ions and the nutrients that are found in plasma. And we mentioned the percentages of each of them. And we said the greater part of plasma, about 91.5% of plasma is made up of water. And then we went ahead to look at, to say that that blood is made up of two main elements, which are the cellular elements and plasma. And then we said that plasma is the liquid part of blood, and then the blood cells are the cellular elements of blood. And then we said that the blood cells are 3 in number. That there are 3 blood cells in number. And we said they are the red blood cells or erythrocytes, the white blood cells, or the leukocyte, and the platelets, which we call the thrombocytes. In that class, we said that the erythrocytes are produced in the bone marrow, and that is in an adult, but in a fetus, they are produced where? In the liver, right? Can you remember that we said that red blood cells are produced in the liver for a fetus, but in the bone marrow in an adult? And then we also hemoglobin for everybody. That's strong. When the red blood cell or the heals the gain, that ion is needed also. So the liver where it is conjugated, and some part of it is added bile during the digestion of fat, so emulsification of fat. So that bilirubin goes there where it is used to emulsify fat. And then we went ahead, I think that was everything we said about red blood cell. And then we said also that red blood cell, the value or the content of red blood cell in a male is different from that in a female, that males have more red blood cells, about 450 million, I think, red blood cells, in a pinhead of blood. While in women, it is less than that value. We also said that red blood cells are produced in the bone marrow through a process that is called erythropoiesis. And for that to happen, we need a kind of protein, or maybe a hormone, we could say, that is called erythropoietin, that is produced in the kidney. So that erythropoietin stimulates the production of red blood cells. Okay, so today we would now look at a different kind of blood cell, which is called white blood cell or leukocyte. So that will be our focus for today. Leukocyte and thrombocyte, platelets, we'll look at today. So the white blood cells, as you can see on this slide, are also called leukocytes, and they have a kind of shape we call amoeboid shape, and they are nucleated. Remember, we said that for red blood cells, they do not have nucleus, so they are non-nucleated, but white blood cells are nucleated, so that means they have a nucleus. But white blood cells have different shapes, so we would say that they have an amoeboid shape. In terms of size, they are a little bigger than the red blood cells. So they have a 12 to 15 micrometers in diameter. But in red blood cells, we said it is 7.5 micrometers. Now, white blood cells, unlike red blood cells, are colorless and translucent. So they are not they are not red in color. You remember we said that for remember we said that for red blood cells, because of the pigments, the hemoglobin gives it its red color. But for the white blood cells, they do not have hemoglobin, and because they do not have hemoglobin, they do not have a red color, so they are actually colorless. In terms of counts, there are about 5,000 to 10,000 white blood cells per microliter of blood. 5,000 to 10,000 white blood cells per microliter of blood. So we have fewer white blood cells compared to red blood cells. For red blood cells, we said that there are about 5.4 million red blood cells in an adult male, while a female had 4.8. So this is in millions. But for white blood cells, it is in thousands. So 5,000 to 10,000 white blood cells per microliter. So it means that we have more red blood cells in our body than white blood cells. And from what we said, the white blood cells are bigger, are larger in size. In terms of the lifespan of the white blood cells, it is 10 to 13 days. So they have a shorter lifespan also when compared to the red blood cells. We said the red blood cells would live up to 120 days, but the white blood cells do not live that long. They live 10 to 13 days, probably because they are always engaged in a fight. They are always fighting against, infection, bacteria, and viruses. And because they are always engaged in a fight, most of them die, in the process. And so that is why they have a very short lifespan when compared to the red blood cells. Now, the process of production, by the way, we will talk about the function of red blood cell, of white blood cell, which is not mentioned here, but we're going to explain it. So for the white blood cells, they are produced through a process that is called leucopoiesis. Just the way we have erythropoiesis for red blood cells. For the white blood cell, it is called leucopoiesis. So this is the production or the process of production of white blood cells. And this happens in the liver, spleen, tonsils, and bone marrow. For red blood cells, it was mainly the bone marrow of an adult. But for the white blood cells, it can be produced in the liver, in the spleen, in the tonsils, and in the bone marrow for an adult. And then for a fetus, it is produced in the liver and the spleen. Now, these white blood cells are produced in response to a protein that is called leucopoietin. So leucopoietin stimulates leucopoiesis, just the way erythropoietin stimulates erythropoiesis. And leucopoietin is also produced or released, from what we call the neutrophils. So the neutrophils release these leucopoiesis, and they stimulate the process of leucopoiesis. Now, leucopoiesis would increase when your body is fighting maybe an infection. There is an infection that your body needs to fight. There needs to be an increase in the production of white blood cells to fight. But even if there is no infection, leucopoiesis takes place normally in your body. But of course, when there is an infection to fight, it is just natural for us to have an increase in the process of leucopoiesis, because most of the white blood cells fighting against any bacteria or infection die in the process. And so we need to replace them. And that's why leucopoiesis has to increase. Now, if we have excess production of white blood cells, it will lead to what we call leucocytosis. So an increase in the number of white blood cells above the normal value. We have said that the normal value is 5,000 to 10,000 white blood cells per microliter of blood. So, but what about if we have up to 14,000, white blood cells in a microliter of blood? So that would be leucocytosis. That is excessive, higher than the normal amount. And in most exams, you're going to be given figures or values of white blood cells. They're going to tell you that a patient, had maybe 12,000 white blood cells or 13,000 white blood cells. What is your diagnosis? What do you suspect? Why is this patient having that? So most likely, it is because of leucocytosis. So leucocytosis simply means an increase in the number of white blood cells above the normal value. So the range is 5,000 to 10,000. So if the patient has 7,000 white blood cells, it's normal. If the patient has 5,000 white blood cells, it's normal. If the patient has 8,000 white blood cells, it is normal. If the patient has 9,000, it's normal. But once it exceeds 10,000 white blood cells, then there is leucocytosis. And there are certain reasons why that can happen. Whenever there is an infection, like I said before, if the patient is fighting a bacteria, for example, there would be leucocytosis. So when you see that leucocytosis, it tells you that it is because your body is fighting an infection. There's an infection somewhere. That is why there is leucocytosis. Later, we'll look at different types of leucocytosis. We'll have neutrophilic leucocytosis with shift to the left or shift to the right. So we're going to look at all of that later when we start looking at each of the blood cells in details. Now we're just giving a summary or an overview of what each of the cells do and what they look like. But later we would have a separate lecture on each of them, and we'll look at the whole process of erythropoiesis, how it starts from the stem cells until we have the reticulocyte, until we have the erythrocyte. The same thing we will do for leucopoiesis. We'll look at the beginning of the process. So this leucopoiesis is a whole process, which we're going to look at later. But here we'll just look at a definition of it and then look at what happens if there is excess production of white blood cells. Now, a decrease in number of white blood cells is known as leukopenia. So leucocytosis is excess production of white blood cells or excess number of white blood cells, whereas leukopenia is a decrease in the number of white blood cells below the normal value. So if a patient has, for example, 3,000 white blood cells, that patient is having leukopenia because it is lower than the normal amount, which should be 5,000 to 10,000. In some countries or in some textbooks, the value is put at 4 to 9. So 4,000 to 9,000. Okay, so if you see in an exam where they say that what is the normal value of white blood cells, and you see 4,000 to 9,000, that is also correct. It is not wrong if there is no other option that is close to that. So 4 to 9 is correct. And I know that in Ukraine here, they use the 4 to 9 value. So if a patient has 4,000, 5,000, 6,000, 7,000, 9,000 is normal. But anything below 4,000, so now the patient has 3,000, then that will be leukopenia. Or the patient has 11 or 12,000, that will be leucocytosis. And leukopenia, of course, would be dangerous for your health because it simply means that you do not have enough white blood cells to fight against infection. So when somebody has leukopenia, it means that such a person would most likely be prone to suffering different kind of infections, recurrent infections, because there are not enough white blood cells to fight. And these white blood cells, as you will see later, make up your immunity, your immune system. So someone with leukopenia would have a decreased immunity. And when you have a decreased immunity, it means that you are prone to suffering all manner of infections, but we'll look at that later. Now, sometimes there could be a pathological increase in the number of white blood cells. Now, pathological increase, not just a little increase, but a huge increase where you could find, white blood cell values of maybe 20,000 white blood cells in a microliter of blood. So look at the distance between 4 to 9 or 5,000 to 10,000, but now we have 20,000. So that should tell you that there is leukemia, or what we call blood cancer. And when there is blood cancer, there is excessive, unregulated, unrestrained production of blood cells, especially of the white blood cells. So when you have excessive, abnormally excessive, or pathological production of white blood cells, then we have what is called leukemia. And there are different kinds of leukemia, which we would also discuss later. We have acute leukemias and chronic leukemias, and we will look at each of them. We have different types of leukemia, and I will tell you how to differentiate them. We have acute myelogenous leukemia, we have chronic myelogenous leukemia, and we have acute lymphocytic leukemia and chronic lymphocytic leukemia. So we'll differentiate all of them and tell you how to identify when you see a leukemia. And again, in a leukemia, you will find what we call blast cells. Blast cells. In the process of leucopoiesis, you will see what we call leucoblasts in the process, leucoblasts. So, but those leucoblasts are not supposed to be found in a normal blood, because at the end of leucopoiesis, what we should get are leukocytes, not leucoblasts. Okay, so when you find blasts in huge amounts in the blood, then you know that now in leukemia, you don't only find excessive number of white blood cells, you will also find leucoblasts, which are not supposed to be found. And so when you find that, you know that there is leukemia or there is blood cancer. But we will discuss all of that later. So leucocytosis, excess production of white blood cells. Leukopenia, decreased in the production or a decrease in number of white blood cells. And then leukemia is pathological increase in the number of white blood cells, accompanied by the presence of blast cells or leucoblasts, and we also have what we call myeloblasts, which we'll talk about later. Good. So now, what are the types of white blood cells? We have different types of white blood cells, with each of them having a specific function. And by the time we begin to look at white blood cells, in details, we will talk about the functions of each one of them, how they are produced, under what circumstances are they released or are they produced. We'll talk about that. But today we'll look at the classification of white blood cells. The white blood cells can be classified into two main groups. We have the granular or the granulocytes, and then we have the agranulocytes. So white blood cells generally are classified into granulocytes and agranulocytes. So we could say leukocytes are classified into granulocytes and agranulocytes. So granulocytes are white blood cells with granules. Okay, they have granules in their nucleus. Now, these white blood cells contain some protein granules, and some of these granules are released when there is, a reaction, like a kind of immune reaction when the body needs to fight against some bacteria. These granules are released, and these granules are of different types. So we have the three main types of granular leukocytes, or what we call granulocytes, are neutrophils, acidophils, or what we call eosinophils, and then basophils. So the granulocytes are three. The first one, neutrophils, they are more in number. They are the highest number of white blood cells, neutrophils, and they make up 62% of the white blood cells. So neutrophils, 62% of white blood cells, and then we have eosinophil or acidophils. Now, why are they called acidophils? Because they are acidophilic, in nature. They have affinity for acids. And when you stain them, they stain pink in color. Okay, so remember this, that acidophils are also called eosinophils, and they stain pink in color during histological tests. When you want to identify them, you identify them by the pink color. And now these acidophils or eosinophils, they have their specific function, which we'll talk about later. They have a role to play in allergic reactions. We'll talk about that. Then we'll have the basophils, which are from the name basophilic. So philic means affinity or love or attraction. Then basophil is from base or alkaline. So basophils are alkaline, they have affinity for alkaline solutions, while acidophils have affinity for acidic solutions. So another name for acidophil, I said, is what? Eosinophil. So the three main granular leukocytes or granulocytes are neutrophil, acidophils, and basophils. Acidophils or eosinophils make up 2.3% of white blood cells, while basophils make only 0.4% of white blood cells, while neutrophil has 52%, make up 62% of the white blood cells. And then the other group of white blood cells are called the agranular or agranulocytes, or agranular leukocyte or agranulocyte. So from the name agranulocyte, it means that they do not have granules in their cytoplasm. So their cytoplasm do not have granules, just like unlike the granulocytes. Now, these agranulocytes are of two main types or groups. They are the lymphocytes and the monocytes, the lymphocytes and the monocytes. So the lymphocytes, they make up 30% of the white blood cell count, while the monocytes make up 5.3% of the white blood cell count. And we'll look at the function of each of them later. The lymphocytes are the main immune cells, and they are of three different types, which we'll look at. Two different types, which we'll look at later. We'll have the B lymphocytes and the T lymphocytes. And the T lymphocytes are further divided into helper T lymphocytes, suppressor T lymphocyte, and the killer T lymphocyte. So lymphocytes are divided into B lymphocyte and T lymphocyte, and the T lymphocytes are further divided into helper T cells, suppressor T cells, and the killer or cytotoxic T cells. But we'll talk about them in details later. And then we'll have the monocytes, which become macrophages, and they help to engulf bacteria and other invading microorganisms. So what you need to know about white blood cells is granular and agranular. Granular, there are three types: neutrophils, acidophils, and basophils. Agranular, they are lymphocyte and monocyte. Now, you must not forget these percentages. These are exam questions. You need to know how many percentage of the white blood cells is neutrophil. So you must remember that it's 62%. Because in exams, they would give you a blood sample showing you that this patient had 62% neutrophil and had maybe 50% lymphocyte, for example. So that should tell you something, that the lymphocyte is not normal. It's supposed to be 30%. So if a patient has 50% lymphocyte, it shows that something is wrong somewhere. Or if you find that the number of acidophils or eosinophil increases to 10 instead of 2.3%, that should tell you that something is wrong, with you or whoever that blood sample was taken from. And these values will help you know what kind of infection you have, because each of these white blood cells respond to certain kind or specific kind of infections. For example, somebody with a viral infection should have an increase in lymphocytes. Now, remember that these normal values is what you find in the blood when there is no infection. But when there is an infection, lymphocytes will increase in number. And so then you have what we call lymphocytosis, to an increase in number of lymphocytes, because the lymphocytes that are responsible, especially the T lymphocytes, for example, that are responsible for fighting viruses. And then when you see that there is an increase in neutrophils in the blood of a patient, then you should know that there is a bacterial infection. And then, for example, if there's an increase in acidophils or eosinophils, you should know that that person is having an allergy or is responding to a parasite. If it has a parasitic infection. So all of these will tell you what kind of infection the patient has, and they will help you in diagnosing, the patient and giving the right treatment. So that is why you shouldn't forget these values. The highest of them all is neutrophils, 62%, followed by the lymphocytes, 30%, and then we'll have the monocyte, 5.3%, and then we'll have the eosinophil, 2.3%, and the basophil, 0.4%. Very important. Okay, good. So now this table gives a description of each of the white blood cells. So we have the granular white blood cells, or what we call the granulocytes. Now, we said already that there are three types. They are the neutrophils, the eosinophils, and the basophils. So here you find the appearance of the neutrophils. You would notice from this picture here that the neutrophil has some kind of lobes. So you see these lobes that look like an earpiece, right? Now, these lobes, you will find that it has about 3 to 4 lobes. 1, 2, 3, 4. Yeah, so it has about 3 to 4 lobes. So neutrophils have about 3 to 4 lobes. And when you stain them with dye, they are neutral. That's why the name is called neutrophil. They are not acidophilic, they are not basophilic, they are neutral. So that is why they are called neutrophils. They are not attracted to acid, they're not attracted to base. Okay. Now, when you stain them with the dye, the name of the dye is called hematoxylin. So this is the dye you use to try to identify the type of white blood cell. So when you put hematoxylin and this the white blood cell is neutral to hematoxylin, then you know that it is a neutrophil. And in appearance, it has 3 to 4 lobes. So what is the function of the neutrophil? Like I said before, the function of the neutrophil is to destroy bacteria by phagocytosis. So phagocytosis means that this bacteria, this neutrophil will engulf, that bacteria and then secrete chemicals that would kill the bacteria. And you have this as part of your first line of defense in your body, in your immune system. Later we'll look at the whole immune system. You see how the neutrophil actually engulf the bacteria and how they kill the bacteria. So without neutrophils, we would all probably die from bacterial infections. But because we have neutrophils, and every day we are exposed to bacteria, every single day we are exposed to bacteria, but thank God we have neutrophils, and neutrophils are able to destroy those bacteria, even without us knowing that our neutrophils are fighting for us and protecting us. So the function of neutrophils is to destroy bacteria by phagocytosis. So we'll look at the whole process of phagocytosis later. Now, they are produced, as we said, in the bone marrow, okay? Now, the second type of the granular white blood cell is the acidophils. Now, the acidophils, they have two lobes. This is one lobe and this is another lobe. And you can see, because of the stain, you can see the granules, these are granules, you know, in the cytoplasm, yeah? Now, when you stain this with a dye, an acidic dye, which is called eosin, it gives you this kind of pink, almost pink color. Now, that tells you, that is why it is called eosinophil, because it has attraction, it reacts to eosin. So you can call it eosinophil or you call it acidophil. Now, what is the function of the eosinophil? Now, the eosinophil combats the effect of histamine in allergic reaction. So, you know, eosinophils are involved in allergic reactions, like I said before. And I also mentioned that they also respond to parasitic infections, and they are produced in the bone marrow. So whenever there is an allergy, you will find that the number of eosinophils will increase. Here we said that it is 2.3%, but when there is an allergy, you should have, you know, eosinophils that are maybe close to 10% of eosinophils. So that's to tell you that there is an allergic reaction. Then the basophils, as you can see here, they have indistinct lobes. So the lobes are not separated, they are joined together. So you cannot actually count how many lobes they have because they are all joined together. And when you stain this white blood cell with a basic dye, which is called methylene blue, it gives you this blue color here. So basophils are stained blue with methylene blue, and that is why they are called basophils, because they have affinity or they react to this basic or alkaline dye. Now, what is the function of the basophils? They liberate heparin and histamine in allergic reactions to intensify inflammatory response. So they liberate heparin and histamine in allergic reactions to intensify inflammatory response. Later, we will talk about inflammation. We'll look at the whole process of inflammation, and we will see the role of basophils in inflammation. Now, where are they produced? Again, in the bone marrow. So don't forget the function of each of them. This one destroy bacteria and phagocytosis. This one combat the effect of histamine in allergic reactions, and basophils liberate heparin and histamine in allergic reactions to intensify inflammatory response. Now, let's look at the agranulocyte, the agranulocyte. So the agranulocytes, as we said, are the lymphocytes and the monocytes. Now, in appearance, the lymphocytes, they have a nucleus that is round. So they have a large round nucleus. And the lymphocytes are the smallest of the white blood cells in terms of size, not in terms of percentage. Because we said in terms of percentage, they make up 30% of the white blood cells. But in terms of size, they are the smallest of the white blood cells. And they have a round nucleus. Now, what is the function of this lymphocyte? We said that they produce antibodies. So they make up the bulk of your immune system. So they produce antibodies and fight against viruses, kill viruses and other microorganisms that try to invade your body. So the B lymphocytes, actually, I told you they have two types of lymphocytes, the B lymphocyte and the T lymphocyte. The B lymphocytes are actually responsible for antibody production, okay? But for that to happen, they also need the help of helper T lymphocyte to stimulate the conversion of the B lymphocytes into antibodies. And then the suppressor T and the killer T fight directly to destroy viruses and other invading microorganisms. But this time around, the lymphocytes are not produced only in the bone marrow. They are also produced in the spleen and in the tonsils. So what did you notice? All granulocytes are produced in the bone marrow, but lymphocytes are produced also in the spleen and in the tonsils. Now let's look at the monocytes. So monocytes, they are the largest of the white blood cells. Monocytes are the largest of the white blood cells because they become macrophages. They grow in size, become bigger, and engulf, microorganisms or ingest microorganisms. Now the nucleus has a kidney shape, okay, large kidney shape or bean shape. You know beans, right? So the shape of the nucleus is bean shaped or kidney shaped. So that is an exam question also. The shape of monocytes, they are bean shaped or kidney shaped, while lymphocytes are round in shape in terms of the nucleus. So the function of the monocyte is to ingest microorganisms, to engulf microorganisms and help to, kill those microorganisms after they've been engulfed, and they are produced also in the bone marrow. Okay, so that is that about the white blood cells. Now we would look at platelets. We'll look at platelets. But before we look at platelets, let's quickly do a revision of the white blood cells. So we said the white blood cells are called leukocytes. Leukocytes, and they are produced in the bone marrow, in the spleen, in the tonsils, in the liver. And then these white blood cells, we said that in terms of number, they are fewer than red blood cells. So we have about 5,000 to 10,000 white blood cells per microliter of blood, or 4,000 to 9,000 white blood cells per microliter of blood, depending on which material and which country value you're using. And then these white blood cells are produced by a process called leucopoiesis. Leucopoiesis takes place, in the bone marrow and other places that we mentioned earlier. And leucopoiesis is stimulated by leucopoietin, which is a protein that stimulates the production of leukocytes. And we said that the lifespan of the leukocyte is shorter than that of the erythrocyte. While erythrocytes live up to 120 days, the leukocytes or the white blood cells live only between 10 to 13 days. They do not live longer than that because they are always fighting against, bacteria and viruses, and they die in the process. And then after that, we said that the white blood cells are of two main types, the granulocyte and the agranulocyte. So the granulocytes have a granular cytoplasm, while the agranulocytes do not have granules in their cytoplasm. And the granulocytes, we said, are three types in number: the neutrophils, the eosinophils, and the basophils. I would say the neutrophils are more in number, about 60% of them. And then we have the eosinophils, about 2.3%. And the basophils are about 0.4%. And then the agranulocytes, we said, are the lymphocyte and the monocyte. And the lymphocyte, we say, are about 30%, in number. And then the monocyte is about 5.3% in number. And here we have the different functions of each of them and the shape of their nucleus. Okay, let's look at the platelets. So the platelets are the last group of blood cells, because we said there are three main types of blood cells: erythrocyte, leukocyte, and thrombocyte. So another name for the platelets is thrombocyte. And these thrombocytes have a major function, very important function. But before we get to their function, let's look at the shape and the size of these platelets. So these platelets, they are circular, biconvex, and non-nucleated. So just like the red blood cells, they are non-nucleated, but they are biconvex. For the red blood cells, they are biconcave. So red blood cells are biconcave, disc shape with a depressed center, but platelets or thrombocytes are biconvex, and they are also non-nucleated, just like the erythrocytes. And the size of the platelets, it's smaller than that of the red blood cells. We said the red blood cells, they have a diameter of 7.5 micrometers, but the platelets have a smaller diameter, which is 2 to 4 micrometers. In terms of quantity, or the count, the number of counts per microliter of blood, we have 150,000 platelets to 400,000 platelets. So 150,000 to 400,000 platelets per microliter of blood. Now, this tells you that we have more platelets per microliter of blood than white blood cells, because we said white blood cells, we have about 5,000 to 10,000. But here, for platelets, we have 150,000 to 400,000 per microliter of blood. And this is very, very important, because when you have a decrease in the number of your platelets, it's going to result in what we call thrombocytopenia, which is not healthy for you, which could lead to a lot of hemorrhage and bleeding that might lead to loss of life or hypovolemic shock later. Good. Now, the lifespan of the white blood cells is 5 to 9 days. The lifespan of the white blood cell is 5 to 9 days. Now, it means that these white blood cells have a shorter, these platelets, have a shorter lifespan than the red blood cells and the white blood cells. So platelets have a shorter lifespan than red blood cells and white blood cells. So because they live only 5 to 9 days. So the function of the platelets is blood clotting. So your blood is able to clot thanks to platelets. Without platelets, we would all bleed from little injuries and eventually die, due to excessive loss of blood. Without platelets, we would be bleeding from our nose, we'll be bleeding from our teeth, from our gums, and any little injury, we would bleed a whole lot. So platelets help our blood to clot and prevent excessive loss of blood. So it helps us to maintain our blood volume. And we said that the process of blood clotting is a positive feedback mechanism when we're talking about homeostasis. So very important. Now let's go ahead. The process of production of thrombocytes is called thrombopoiesis. Thrombopoiesis. The production of platelets is known as thrombopoiesis. And of course, it is in response to the release of a protein called thrombopoietin. Thrombopoietin. Just the way we have erythropoietin and leucopoietin, we also have a thrombopoietin, which is released from the kidney and the liver to stimulate the production of platelets. Now, platelets are the fragments of large cells called megakaryocytes that remain in the bone marrow. So in the process of thrombopoiesis, you have, what is called megakaryocytes, and these megakaryocytes, give rise to the platelets or the thrombocytes. Okay. Now, this happens in the bone marrow also. So remember that the red blood cells and the platelets are produced mainly in the bone marrow, while in the white blood cells can be produced in bone marrow, in the tonsils, in the liver, even in the spleen. Okay. Now, an increase in the number of platelets is known as thrombocytosis. So excessive increase in the number. So imagine that a patient has thrombocytes of 600,000 platelets per microliter of blood. That has far exceeded the normal value, which we said should be around 150,000 to 400,000. But now this patient has 600,000 platelets per microliter of blood. So that is thrombocytosis, and to be honest with you, that is dangerous because it means that there will be excessive blood clots. Your blood will just clot on its own, excessive blood clot. And when you have excessive blood clots, it is dangerous because it will lead to the formation of what we call a thrombi, and that thrombi will become an emboli, and we have what is called thromboembolism. So thromboembolism simply means that there is excessive blood clots, and that clot is transported, that thrombi is transported, and it becomes an emboli. And then that can go to your lungs and block your pulmonary artery. So once your pulmonary artery is blocked, we have what is called thromboembolism, pulmonary thromboembolism. So it means that that thrombi will go and block blood flow. So blood will no longer be able to get to your lungs adequately. And once that happens, respiration will be affected, and that is dangerous, And again, if excessive blood clot is formed, the clot could block anywhere. The clot could block, for example, your carotid artery. Imagine that there is a blood clot on your carotid artery. What will happen is that there would be ischemia of the brain because the carotid artery, we said, supplies blood to the brain. So just imagine that you have excess thrombocyte and it forms clot, and that clot blocks blood supply to your brain, then there is trouble. If that happens in your coronary artery, there is trouble also because the coronary artery supplies blood to the heart. So it means that the heart cannot get blood anymore. When the heart cannot get blood, it cannot function. There will be a kind of myocardial infarction. And when the heart cannot function, the whole body is in trouble because blood cannot be pumped to the rest of the body. So thrombocytosis is not a very good thing. It's not a very good thing. Okay. So what we want to do is to maintain a normal amount of thrombocytes. At the same time, on the other hand, a decrease in the number of platelets is known as thrombocytopenia, which is also not very good because when we have thrombocytopenia, it means that we lack the normal amounts of platelets that are needed to keep the exact volume of blood or that are needed to help us clot blood when there is bleeding or hemorrhage or something, So if you have thrombocytopenia, you stand the risk of excessive bleeding. So you would begin to bleed from your nose. We have what we call epistaxis. So you have epistaxis, blood, you bleed from your nose. You might even bleed from your gums also. When you're brushing your teeth, you could bleed from your gums. And you could even have hemorrhages, from your stomach, or, so thrombocytopenia is not a good thing also. So that is why we have the process of homeostasis to try to balance the normal amount of these blood cells. Okay, good. So here we will talk about briefly the blood clotting process. So the blood clotting process is a process in which blood loses its fluidity and becomes a jelly-like mass few minutes after it is shed out. So blood clotting is a process in which blood loses its fluidity and becomes a jelly-like mass few minutes after it is shed out. So the blood becomes thicker, than it should be, just to avoid excessive loss of blood through hemorrhage or bleeding. Now, here you will find the process. You will find the process of blood clotting. So what happens in blood clotting is that there is an injury to your blood vessel. So there's a puncture of the blood vessel. And once that happens, platelets will come to this place. Remember, the function of platelets is for blood clotting. So once there is an injury to your blood vessels, platelets come to that place where that injury is, where that punctured vessel is. And once the platelets come there, they begin to initiate the process of blood clotting. Now, these platelets, they have some factors or some, proteins and enzymes that are called blood clotting factors. Blood clotting factors. Later, we would look at the different types of blood clotting factors, about 12 to 14 of them we have. And we'll look at the role of each of them in the blood clotting process. So the third thing that happens is that platelets and damaged tissue cells release prothrombin activator, which initiates a cascade of enzymatic reactions. So this is the blood clotting process initiated by the platelets. So this prothrombin activator activates prothrombin, which is the second clotting factor. I told you that we have about 12 of them and a little more. Now, once prothrombin is activated, it is converted to thrombin. So prothrombin is converted to thrombin, but this happens in the presence of calcium ions. So calcium ions act like a kind of catalyst, to stimulate or speed up the conversion of prothrombin to thrombin. So prothrombin activator converts prothrombin to thrombin, and then this thrombin converts fibrinogen or soluble fibrinogen into what we call insoluble fibrin, also in the presence of calcium ion. So calcium ion is regarded as the fourth clotting factor, okay? Fibrinogen is regarded as the first clotting factor. So what happens is that once thrombin is formed, thrombin now activates or causes fibrinogen to be broken down into what we call fibrin in the presence of calcium ions. Then this fibrin now forms a thread or a mesh, okay, which traps red blood cells. So you see that mesh blocks that place so that there would not be excessive bleeding from that site of injury. So what has happened is that the bleeding that would have happened here will be prevented or will be reduced, because if we don't block this place where there is a puncture of the red blood cells, you would lose a lot of blood through bleeding. So our goal here is to produce fibrin, because fibrin forms a mesh or a thread that blocks that punctured region to prevent blood loss through bleeding. So this is a simple process of blood clotting. But in the future, when we talk about each of the blood cells in details, we would look at the blood clotting process. We'll look at the two pathways. There's an intrinsic and an extrinsic pathway of blood clotting, which we will discuss in details later. But remember that the function of platelets is to maintain blood volume by preventing excessive blood loss, and that happens in the following way. There is injury to the blood vessels, the platelets form the plug, and then they release, prothrombin activator. Prothrombin activator converts prothrombin to thrombin in the presence of calcium ions, and then this thrombin now converts fibrinogen to fibrin in the presence of calcium ions also. And then fibrin forms a mesh or a thread which traps the red blood cell and prevents bleeding, further bleeding. Okay. Now, lastly, I think we have what is called anticoagulant. Anticoagulant. From the name, anti means against, and then coagulant. So coagulant or coagulation. What happened here, this clot formation, is a kind of coagulation. So the blood becomes thicker and coagulates. But here we have what is called anticoagulant. So anticoagulant is a substance which prevents the coagulation of blood. Anticoagulant is any substance which prevents the coagulation of blood. Now we have a natural coagulant in our body, which is called heparin. So heparin is a natural anticoagulant against coagulation of blood. If we don't have heparin in our blood might just on its own, because we have thrombocytes, begin to coagulate. So, but we have a natural anticoagulant that checks the coagulation process and makes sure that our blood does not just coagulate, unnecessarily. So that's why we have this heparin. And then we have other anticoagulants also in the form of drugs, okay? But heparin is the natural one. We have what is called also the warfarin. We have warfarin, but that is a drug that does the same function. But I didn't mention there's something called vitamin K. Vitamin K also plays a role also in coagulation of blood, vitamin K. So if somebody lacks vitamin K or lacks calcium, such a person will have excessive bleeding. But we'll look at that in detail later. We'll look at the role of vitamin K in clotting or coagulation. So if blood clots too easily, the results can be thrombosis, clotting in an undamaged blood vessel. So there is no damage, no puncture of the blood vessel, but there is thrombosis. We said earlier that thrombosis, thrombosis is only supposed to take place, or blood clotting is supposed to take place when there is puncture or injury to the blood vessel. So to prevent bleeding, we have thrombosis, or we have production or clotting process. But now, when the blood clots on its own without damage to the blood vessel, then we have what is called thrombosis. And like I said before, this thrombosis can lead to the production of a thrombi, which becomes an emboli, which now causes what we call pulmonary thromboembolism. Okay. Then, if the blood takes too long to clot, we have hemorrhage. So if the blood takes too long to clot, there will be hemorrhage. So what it means is that when I have thrombocytosis, I will have thrombosis. When I have thrombocytopenia, because here we said thrombocytopenia. I thought I mentioned thrombocytopenia somewhere. Okay, I didn't mention it. Okay, yeah, we did. So thrombocytopenia here, decreased amount of platelets. So when there is thrombocytopenia, what will happen will be hemorrhage, because there's not enough platelets to clot blood. And then when we have thrombocytosis, what will happen will be what? Thrombosis. So this is all you need to know for now about the different types of white blood cells, the erythrocyte, the leukocyte, and the thrombocyte. So in our next class, we would now look in details, because what I gave now is just an overview of the three types of blood cells. In the next class, we will look in details at each of these blood cells and look at the process of their production from the beginning to the end of their production and the metabolism of the hemoglobin. We'll look at all of that in next lecture. Do you have any question?
Yes, sir.
Okay. What is your question?
I don't have no question, sir.
No question. Okay, good. So thank you very much. I'll see you in the next lesson. Bye.